Hello everyone. Today's topic is the blood group. The blood group is a type of, also called as blood type. Classification of blood is based upon the presence or absence of antigenic substances on the surface of RBCs. These antigens may be proteins, carbohydrates, glycoproteins, or glycolipids, depending on the blood group system. Next is the ABO blood group system is the most important blood type system in human blood transfusion. ABO blood types are also present in some other animals, for example, rodents, apes such as chimpanzee, bonobos, or gorillas. Determination of ABO blood group depends upon the immunological reaction between antigen and antibody. Antigens, also called as agglutinogens, because of their capacity to cause agglutinations of RBCs. History of blood group is Carl Landsteiner discovered the ABO blood group system in 1901. Uh, Adreno Sturley and Alfred von de Castello, who were working under the Landsteiner discovery, a type AB year later in 1902. Landsteiner was awarded the 1930 Nobel Prize in Physiology or Medicine for his work. Then Jansky is created with the first classification of blood into four types, A, B, AB, and O in 1907, which remains in use today. Ruben Osterberg successfully transfused blood between two people at Mount Sinai Hospital in New York. He was the first person to record pre-transfusion testing for blood compatibility in clinical setting. Later in 1954, he was the first to be awarded with Karl Landskog Award. Next is the ABO basics. Based upon the presence or absence of antigen A and B, blood is divided into four groups: A, AB, B, and O. Blood having antigen A belongs to A group. This blood has B antibody in the serum. Blood with antigen B and alpha antibody belongs to B group. If both the antigens are present, blood group is called AB group, and serum for this group does not contain any antibodies. If both antigens are absent, the blood group called is O group, and both alpha and beta antibodies are present in the serum. Next is the importance of ABO blood group in blood transfusion. During blood transfusion, only compatible blood must be used. The one who give blood is called as donor, and the one who receive the blood is called as recipient. While transfusing the blood, antigen of the donor and the antibody of the recipient are considered. Antibody of the donor and antigen of the recipient are ignored. Ignored mostly. Thus, RBCs of O group has no antigen, so agglutination does not occur with any group of blood. So, O group blood can be given to any blood group persons and people with this blood group called as universal donor. Plasma of AB blood group has no antibody. This does not cause agglutinations of RBCs from any other group of blood. People with AB group can receive blood from any blood group person. So people with this blood called as universal recipient. RS blood group system. In that, the RS blood group system is one of the 35 current human blood group system. It is the most important blood group system after ABO. RS blood group system consists of 50 defined blood group antigens. Among there are six common types of RH antigens, each of which is called as RH factor. These types are designated C, D, E, and small c, D, E. The type D antigen is widely prevalent in the population and considerably more antigenic than other Rh antigens. Anyone who has this type of antigen is said to be Rh positive, where a person who does not have type D antigen is said to be Rh negative. This antigen was discovered by Karl Landskog and Alexander Wiener in 1940s. It was first discovered in rhesus macaques and hence the name is Rh factor. Erythroblastis fetalis, hemolytic disease of newborn. Erythroblastosis fetalis is a disease of the fetus and newborn child characterized by agglutinations and phagocytosis of fetus RBCs. In most instances of erythroblastis fetalis, the mother is Rh negative and the father is Rh positive. The baby has inherited the Rh positive antigens from the father, and the mother develops anti-Rh agglutinase from exposure to the fetus Rh antigen. In turn, the mother's agglutinins diffuse through the placenta into the fetus and cause RBC's agglutinations. In the symptoms and signs in the fetus are enlargement, liver, spleen, or heart, fluid buildup in the fetus abdomen seen via ultrasound. Next, other blood group system are एक मिनट Uberberg group, DGO group, Bombay group, Duffy group, Lutheran group, P group, Kale group, I group, Kid group, Sulter XG group, Kid group, and Duffy group. So that's all. This is all about the blood system. Blood group.